everyone. Welcome to Talk to Us today. I'm Simrit.
And I'm Namita. And today on Talktoustoday, we have our segment, Sheroars. And in this segment, we speak to our inspirations. These are women who have roared ahead in their fields and inspire us with their perseverance and strength. Today, we will be in conversation with someone who I personally very fond of, Dr. Meenakshi Ahuja, well-known gynecologist and obstetrician. She has chaired several sessions in various gynecological forums and is a renowned personality in local and international circuits. She has been awarded the Pratibha Tiwari Gold Medal for her achievements as the best resident. Her medical breakthrough is in the field of preventing of cervical cancer associated with Times of India for Meri Beti, Meri Duty Campaign. Currently, she is a director with Fortis La Femme, academic secretary for Delhi Gynae Forum, and president for the Indian Menopause Society, Delhi. Recently, a book was released by Hacchette named Wonder Woman, where a chapter is dedicated to Dr. Meenakshi Ahuja, and we like the word Wonder Woman.
Hi, Meenakshi. Welcome to Talk to Us today. Thank you so much for coming to our show.
My pleasure entirely.
So I wanted to let everybody know first my personal history with you. I had my son when I was 37, which is considered late by most standards now. And since this was my first pregnancy, I was an older patient. I was so scared. You remember this, right? And because you read all these complicated stuff and on the internet, which is full of useless information, I was really worried. And I would call you, like, even when I would be, like, when I was about to go out for dinner or something, oh, can I eat prawns and can I eat this? And you were always there for me. I always tell everybody that my pregnancy was a breeze, my delivery was a breeze, all thanks to Dr. Meenakshi. And, she's always been available, always made me feel so comfortable. And, I've recommended so many patients because of that.
Yeah,
because
to me as well. To me as well.
And but this is not just us. Like, we're not special. We're just patient professionals. You make all your patients feel so special. And I know so many patients of yours. In fact, they all say the same thing about you. And I was looking at, like, before this interview, looking at some Google reviews, and they said, like, there was one Google review that if you're an LGBT patient, you should go to Meenakshi because she's the most non-judgmental and amazing doctor. How do you do that? How do you manage to make all your patients feel like they have a personal relationship with you, especially now? You go to so many doctors and they're so clinical. How do you manage, like, these days to make everyone feel so special? Thank you.
Thank you so much for the compliments. Actually, it's very easy, Simrit. I think if you're doing what you love, it just comes from within. I love my profession. Sometimes, in fact, my kids say that you love your patients more than you love us. But I am so happy at work. I think it probably just reflects in the work. I love my work and I'm very grateful to be there. And as I'm a people's person as it is. And I actually am blessed to be part of so many people's lives and being able to make that small little difference without really trying.
Wow, that's amazing. So, Meenakshi, that we know that you are a family of doctors, but how do you choose medicine and particularly gynecology? And especially like 30 years ago, when most of the people were so squeamish when it came to gynecological health, and more so when we are young. And so, did you have an aha moment when you realized that you wanted to be a doctor and that to a gynecologist?
So honestly, let me put it like that. I probably think from the day I was born, I thought I'm going to be a doctor, because at least from the time I kind of, understood life. My parents are both doctors. My father was director professor of medicine. My mother's a doctor. So my the uncles, everyone is a doctor at home. So it was almost like a no-brainer that I'm going to be a doctor. And I didn't know of anything else, although sometimes I feel that if I wouldn't have been a doctor, probably would have some little cafe tucked up somewhere and make a meal of the day or something, or maybe a stylist, that's something I like too. So maybe something like that. But otherwise, it's been a doctor throughout. While I was in medical school, I was one of the toppers in my batch. And I think gynae was something which was considered, like relatively not so exciting a branch as such. So, I actually felt that, maybe I want to do neurosurgery or general surgery. I was always very excited about being a surgeon. Unfortunately, like we said, we're talking about something. I joined med school in 1983, so if that helps, that was like really long back.
Long
So
back.
my father was very clear at that time, and he said that, look, maybe if you want to do surgery, maybe gynecology is a better line for you. And I was very upset at that time because he said that at that time, probably everyone would like to go to a male surgeon. And he said, despite being a topper and doing so well in college, you will always feel that you're not using your full potential because you're in surgery, because everyone prefers a male surgeon unless you want to do breast lumps and piles in women. So he said either do cosmetic surgery, which would have been quite exciting again, but which I've actually made part of my portfolio, so as to say now. But he said that cosmetic surgery, then we had to work in the burns ward, which was very depressing. I just couldn't do it as a medical student. I was all of 22 years old at that time. And then he said that, okay, maybe we can, you can do pediatric surgery. But till date, I can't handle sick children. I just can't, you know. So then probably it seemed that gynecology was a good mixture of surgery and medicine. And although that time I was a little upset, I'm a topper. How can you make me do gynecology? But at the end of the day, I think that, that once I joined the line, I've not regretted a single day ever since. And I always remember my dad in this because he was the only one who pushed me to do this. In medicine, where every day is happier than the previous one.
Wow.
So, yeah, we deal with miscarriages and unfortunate circumstances also. But the happiness you get in this profession, I don't think you could get in. Probably that's what makes us so positive also.
Wow.
Wow. No, well, you're a class apart when it comes to positivity, anyways. And I did read a little bit about your cosmetic gynecology, which, by the way, till yesterday I had no idea. And we can touch upon that later, but that was really interesting. But you've been practicing medicine for 30 years now, and you've actually helped develop gynecological, changes in mindsets as well. Have you seen the mindset change? Because I remember when we were growing up, when our mothers even told us about our periods, it was so hush hush, ab ye hoega tumhare sath, whatever. And it was a taboo to discuss it. In fact, I remember in my house, which was fairly moderately liberal, but my grandmother told me, I was 11 years old, and when I got to know, Babaji ke kamre mein you can't go to the prayer room. And I said, what? Nonsense. I'm going to go to the prayer room whenever I'm with religion. So I used to go every day, and my mother and grandmother would stare at my face because I was stubborn, and I just went. But nowadays, you can't even imagine telling the kids you can't do this and can't do that.
You'll be surprised, Simrit. I think it's fabulous that you were the change that you wanted to see. I still have women who come to me when they're married and with kids, and they'll say they're going for a religious tour or a pilgrimage, or they have some festival in their house which has a puja, and they would come to me for delaying their periods. So I always tell them, if you want to delay your periods for a beach holiday, I can still understand. But it is very unfair if you do this for this, because if you're doing it, you're going to expect the same from your daughter. And if you are upset about it today and you still follow the same principle, you are going to follow it in the next generation also. So like I said, you have to be the change you want to see in your lives.
That's so true. Even including husbands in this talk was so difficult, isn't it?
Yeah. So times have changed for sure. 30 years has been a long, and it's been a very positive journey in obstetrics and gynae. Earlier when we used to talk about sexual health or something, it used to be very tough. And especially when young girls got pregnant and all, they really didn't know whom to turn to. And the unfortunate circumstances that girls get into trouble because they are not aware, because the information is not available to them. And they don't know where to reach out, which is actually the tragedy of our circumstances. That, man has gone on the moon, women are working, they're professional, everything. But information and empathy is not available. And they really don't know where to turn to. But yeah, 30 years back, I agree with you that it was hush-hush. The times have changed. I've had girls who are unmarried who are pregnant and who have come with their mothers. because they want them to be part of that thing. And the mothers are also changing. Similarly, I have a lot of moms who've been my patients through these years, and they've come to the clinic just to see their young unmarried daughter at the clinic. They had a separate appointment and they had a separate appointment.
That's so
but
good.
They have understood that I will not share their daughter's history with them, whatever it may be. But they know that their daughters are safe. So what I'm trying to say is that's a mindset change in the minds of women, that they're ready to accept, and also for the youngsters to understand that the most important thing here is safety. Parents would also want you to be safe first. And it's not that whatever is taboo or changes or differences in society is a different thing. But the most important thing is that you should be safe and healthy.
Yeah.
Wow.
In all aspects. Yeah.
I remember I couldn't talk to my mother about anything, even about the whole sexual aspect also. I couldn't talk. I never talked even till now, It's just I'm mother of two and still there's this barrier there. But now that when my niece has just started, this whole she's a teenager and she comes and talks to me and I just explain her everything like my mother would have done, because whatever are the reasons during
Should
those
have
times.
done,
Yeah. So I
So
feel
some mothers
comfortable.
can't talk about it.
Yeah.
And I always say that you come to the clinic. Let us talk about it. I'm not going to
Exactly.
see an underage child without her mother being there inside the chamber. And the mothers have to understand that once the girls are 18, they have a right to privacy. So it's both ways, right?
But I have to bring up one point in this.
Also,
Sorry.
we must bring up our boys to be able to
Yes,
talk about it.
that's what I
We need
was
to
going
get
to
our
say.
boys to talk
I
about it.
always say this. I was interrupting you to say the same thing, that I always tell all mothers that the girls, okay, we will take care of that. And we've been taking care. But come on, step up, educate your boys. Don't let them learn about sex through, what's out on there on internet, and teach them how to respect the women. And, the things that we even discuss with our 10, 11-year-old now, we tell him about girls going through periods. So that is really important, to educate our boys as well.
We've had some talks on, our Instagram page, Doctors in the House. So my son is also a 25-year-old who's a doctor. So in fact, when we talked about menstrual health or menstrual cups or pads or something, we made him also do part of it, and he was more than happy to do it.
That's excellent.
Because one has to understand that it's not a women thing. It's a human body, it's physiological, and everyone should be able to talk about it and converse about it.
All right. So just to let everyone know an interesting fact, just like Simrit, Meenakshi is my doctor as well. And she was our obstetrician for our children. And to be honest, I haven't gone since my daughter was born. I want to be honest, Meenakshi. Yeah, I've been planning and I discuss with Simrit all the time, and still I was not able to, come to you. And we women, tend to neglect our health post pregnancy. And even someone like me, who is so very health conscious, yet I have been thinking about coming to see you, but I couldn't prioritize it. And in fact, I think most of us women only go to gynecologist when it is related to pregnancy, or it's period related, or it becomes dangerous situation, with our health. But shouldn't we be more proactive? Like, how often should women be coming to see you, Meenakshi?
Thank you so much for that question. I think that was the most important thing in this whole thing, because, women need to know that they are the pillars of their home, and you think that you don't have time to go and see the gynecologist. But, your child has a small cough or a cold, you'll take them to the doctor. Your husband has a problem, you'll tell him to go and see the doctor, not enter the house without his appointment. So the point is that we think that we don't have time. But always remember that if a woman falls ill, the house falls apart. So it's very, very important, if not for a selfish reason, but for the health of everyone else at home, that you take care of your health and prioritize your health. So definitely, now we start doing checkup, obviously with the irregular periods and all is a different thing. But even if everything's okay, people come to us for a premarital counseling. People come to us for a preconception counseling. I'm talking about normal, healthy women, right? Then they come for contraceptive advice. And once you've had your child and everything, anyway, if you have been sexually active for 3 years or you're over 30, you have to come for your pap smear every year. Also, you need to learn how to do a breast self-examination, which you need to be doing every month, right? You must get your cervical cancer vaccination shots. That's
So much to
one.
be done for me.
That can be given from 9 to 45 years of age. Okay. So you still have time to come and get it done.
Yes,
So that's
I would
one.
definitely.
Then once you're 35, we like to do a breast ultrasound and a pelvic ultrasound, even if everything's okay. And from the time you turn 40, it's very important to come for your regular annual checkup where, men get their checkup done regularly with the blood. And so nowadays with these lab packages, every woman gets that test done and thinks that, that's the end of the story. But please remember, you have a uterus and you have ovaries, which are not seen on the blood test. So you need to come for your breast, whether it's a mammo or an ultrasound or whatever, every year or every 2 years as prescribed by the doctor. Your internal examination, your annual pap smear, your ultrasound, which needs to be done. So that needs to be done, and your supplements. So from 40, you are regularly on some sort of supplements, maybe vitamins, calcium, vitamin D, and wherever deficiencies may arise in your blood work. But yes, at least an annual visit to your gynecologist. I would say, frankly, over 35, but definitely over 40. Once a year, you must come and visit your gynecologist. And usually I would tell girls that December, which is the end of the year, or probably January, which is the beginning of the new year, just fix it, one gynecological checkup, so that it becomes a part of your life and routine and you don't miss it out ever.
So all you wonderful viewers out there, make sure you make your appointment with your doctor, go there, make sure everything is fine, clear. So another really important landmark in our lives is menopause. Now, I have to be honest that we were sent emails by our viewers who specially asked to have an expert on menopause for our show, which you obviously are because you're the president of the Delhi chapter of Indian Menopause Society. And there's so many questions related to like, why is this or what's going on? We all know that the period stop. That's about the be all and end all of menopause that we know. So I'm reading out some questions sent by our viewers. So how do we maintain the balance during menopause, especially for weight gain and mood swings? What can help us with hot flashes and sleeplessness? And one lady sent us, is it true that a woman can't orgasm and enjoy sex during menopause? And can women get pregnant during menopause? So there's some myths in there. So why don't you address it together?
Yeah. So first thing to understand is that, again, menopause is just a normal physiological landmark in our lives. And we spend 2/3 of our adult life in menopause. So if you take your adult life from 20, and menopause can happen anytime between 40 to 55. So more than half your life, you're definitely spending in menopause. So don't dread it, look forward to it. So, we call it menopause rather than menopause. There is no reason to pause your life just because you're reaching menopause. If anything, that emptiness syndrome needs to be changed into, you having prioritized yourself. As women, I think till 20 or 18 or whatever, we live according to our parents and we get married, live along according to our husbands and our children. I think finally, this is the time we learn to live for ourselves.
Yes.
So if you look at it, so I think it's more of a mindset. If you learn that, okay, now let me live my life for myself, you will definitely enjoy this time as far as menopause is concerned, and mood swings and all, though they could be, hormonal also. It could, just the way you look at it and your outlook will definitely help in this situation. So that's number one. So menopause normally will happen at, like I said, any time between 40 to 55. And the average age of Indian menopause is around 46.2 years. So there's nothing to dread it. The perimenopause, that is when the periods are irregular, might last 1 to even 5 years. So it's not that if you start getting a couple of irregular periods, you're menopausal, you're still perimenopausal. And that, just to answer that other question, that is the time when you can get pregnant. But once you've not had your periods for, say, 6 to 8 months, that means you're not ovulating at all. You don't need to use any protection. And then coming to the next question that you had put in, that what about orgasm? Your sex life doesn't change at all. If anything, you're not scared of pregnancy any longer. So your sex life, if anything, should be better. And you don't have small children trying to knock at your doors, and also ideally it should be better. So that's there. However, as time advances, it is possible that you have vaginal dryness, which happens because of depletion of estrogen. But then again, that is not a reason why you need to refrain from sex. What we have seen in Asian women is that they don't like to talk about sex, right? And that's why we like to preempt that question, that when they come to us, that, is there a problem in your sex life, or how often do you have sex? So probably I would ask that, do you have pain when you have sex? And then that woman is going to say, no, I've not had sex for the last 2 years. Why? So again, it's a mindset, right? So if you tell me that there's a vaginal dryness, or, it hurts, there are solutions for it, right? Similarly, for the hot flashes, which indicate that your periods are on the waning side, there is therapy available for it. Of course, we would say, try your natural things first. Yoga definitely helps. Putting a little bit of soy extract in your diet. Soy has natural estrogens. Not a bad idea. Natural people like to use things like black cohosh, red clover. They also help as herbs during the perimenopausal period. But now the International Menopausal Society is very clear that even though this is a transient period where you may have hot flashes, which may last again 1 to even 10 years, you don't need to live with it and get distressed. You remember there was that, again, I would like to bring out that now women, because we are more open about it. And I mean, at the end of the day, there are a lot of career women and women homemakers also who understand their bodies and are ready to talk about it. You remember that there was that Netflix serial called Bombay Begums?
Yes.
It started with that girl in the corporate meeting and then going to the bathroom with a hot flash, which did not let her function normally. So that is it. For me, it was a key, because till now in serials and movies, I just see babies being born.
Correct.
Finally, someone is ready to talk about menopause.
Absolutely.
And it is, it came out of the closet. For me, it was a breakthrough, so as to say that, and so many women could relate to that yes, this happens and they live with it. You don't need to. There is hormonal therapy available, which will help you with this. And it is completely safe. So just the word hormone, steroids, which we have in our mindset that that's bad. There was a WHI study in 2000. 2000 was 22 years back, where they said that probably, there could be little harm of the hormones in the breast cancer, raising, the figures increasing of breast cancer or cardiac disease and all. And then hormones went completely into disrepute, right? And later we realized that the women who were offered those hormones were elderly, obese women over 70 with cardiac problems already. So they were not the right people to be offered that.
So it's a skewed state.
So from 2014, the guidelines are very clear internationally. I'm not talking about Indian menopausal guidelines, which are also the same, but all over the world, the guidelines are clear that if you have vaginal dryness, if you have a risk of osteoporosis, if you have hot flashes or vasomotor symptoms, or if you have had premature menopause, that is before 40, please go on hormones. Discuss with your doctor. Hormones are completely safe and they have less risk of breast cancer than even which is there for a smoker or someone who's overweight or other things. So the point is that it is completely safe and has to be discussed as an option, because see, things go into disrepute because they're used wrongly. If you see, even a lot of sugar or a lot of salt is not good for us.
Absolutely.
Right? So women used to take hormones, the estrogen, only so that they looked young. That is not an indication any longer. But if a woman's life is in distress, there is no reason why she should. And we have now a lot of women who are taking MHT and they're extremely happy with it. And they're able to function normally, enjoy their lives normally, and definitely, I mean, most importantly, live for themselves.
A very good thing that you have said, Meenakshi, live for yourself. That is what we women tend to forget very often, living for ourselves. We just try to live for our family, for our kids, for work, for something or the other, but not for ourselves. So amazing. I think there's a lot of myths out there regarding menopause, and we really need to educate ourselves properly, and definitely not just through Google, right? And
Yeah.
yeah,
Go to your doctors.
we tend to do this. Any problem happens, we quickly, write the symptoms on Google, and let's see, Google doctor should answer our questions, and rather than going to the doctor, real doctor, and getting a proper advice on that matter.
So I think Google we should be using to get good recipes and probably to know what's in fashion.
Yes.
I don't think we should be using Google for anything.
Okay.
So thank you so much. That was so informative. Now we have a little short lightning round for our She Roars segment. So you have to give the first answer that pops into your head, but it has to be honest. What's the weirdest question you were asked as a doctor?
Yeah. So yes, I've been asked that, are you a male gynecologist? So I didn't know where that went, because I mean, I'm obviously female. And then, I couldn't understand what he meant. And then I realized that he said that kind of, can you examine me? I said, no. It's not called a gynecologist, it's called an andrologist, You don't see a gynecologist. So that was one.
So both your kids are doctors. Did you and your husband push them to become doctors?
Not at all. In fact, just the opposite. So my daughter had seen my hectic life, when I was in med school, while I was practicing and, getting up at night, leaving them on their birthdays and everything, at their parties. So probably she had decided that she wants to be a doctor, but not a gynecologist. In fact, even with my son, my husband was quite vehement that he should not be a doctor, because it's a lot of hard work for a lot of years. So we tried to push them the other way. I didn't push them either way, because I had no place to do that. No, my parents are doctors. I became a doctor. How can I tell my kids, no, just because your parents are doctors, you don't become a doctor? He comes from a family of engineers. So he tried to tell them, give them a reality check. But both of them opted on their own. So yes, they are both doctors and completely out of their own choice.
Oh, wow. So you're a great doctor. We know that. But what are you really good at that most people don't know about you?
As in
personal,
non-medical?
Yeah.
Personal? Yeah, I'm a very good swimmer.
Oh, really?
Yeah. So when I was a kid, my brothers were national level junior swimmers. So we used to swim with the Indian team. So I swim very well. I enjoy swimming. That's actually something. That's that 1 hour of meditation I really look forward to in the day, and it makes me quite miserable in the last 2 months. And also that I don't enjoy any other exercise. For me, swimming is, again, it's not an exercise. It's like a meditation and a passion. I love swimming.
Wow, that's awesome.
That was really wonderful. I think that's it. Thank you so much for being so candid, Meenakshi, and thank you for joining us today on Talktoustoday. I feel like, we could have talked about so much more. There's so much coming, into my mind to ask you, but I think because of the time constraint, we really have to cut it short.
Thank you.
Thank you so much for having me. And I look forward to being here again with you sometime.
Yeah, thank you for educating all of our society and being a face that's helped things change for women over the last 30 years, which is like probably something you guys need to get more credit for.
Thank you.
Yeah, that's all on Talk to Us today, but we look forward to hearing from you all. Please tell us what you thought of our She Roars segment by sending us an email at hello@talktoustoday.com, or use the comment section below and let your friends know where to find us. Also, to connect with and talk to Dr. Meenakshi Ahuja, please check the description below, because we'll give all her details and information there. And don't forget to hit the subscribe button and hit the bell to stay notified of our new videos every Friday at 6 p.m. Thank you.
Thanks for joining us on Talk to Us today. Remember to talk about
Talk to Us today. Keep smiling.
Keep laughing.
And keep talking. Thank you so much. See you next Friday.
Thank you.